The question that we set out to answer with this report was essentially around what is contributing to poor mental health amongst new and expectant parents in Aotearoa, New Zealand. So I had the experience of hearing in a previous role I had working for the Children's Commissioner, Sir Peter Gluckman, come to talk about some research that he was part of, medical international research, looking at the impact of maternal distress during pregnancy on babies' cognitive and development and long-term outcomes in life, and was kind of both shocked and somehow not surprised at the same time to learn that maternal mental health was almost the single biggest contributor or predictor of long-term health and wellbeing outcomes for babies. Shocked because if that's the case, we really should be doing so much better, but in some ways not surprised too, because it's quite intuitive. Actually, if we supported parents and mothers better at the beginning of children's lives, we perhaps would have very different outcomes. And we're often thinking about how to repair intergenerational well-being and focus on giving children the best possible start in life. And actually, in many ways, the answer is quite simple in terms of supporting birthing parents and mothers better. So the question, having had that seed planted, the question we set out to answer was really, what is it that's contributing to that stress, and how can we use public policy to remove it? And from that, we gleaned three key insights. So we looked at academic and medical and published academic research on this topic. We looked at the experiences of people who have lived through perinatal distress, and we looked at the expertise of community-led and kaupapa Māori service providers and organisations, clinicians, midwives, doctors who have a lot of interface with communities, and together from those sources we put together this research. So the first insight is really that actually, if we get this right, it could be very transformational for our whānau and communities. Perinatal distress causes huge suffering for parents. It can have lifelong implications for babies, both through that biological transfer I talked about before of the stress response in the body during pregnancy, but also after birth in terms of the impact it can have on parents' communication with their babies, with their ability to bond effectively, with parent-child attachment, mood, how likely parents are to read and sing and speak to their babies. All of these things can be made more difficult by perinatal distress in the family, and the combined result can essentially lock an intergenerational disadvantage for that family. When we're talking about the perinatal period, we're talking about the period from pregnancy until the baby's first birthday, except when we talk about suicide statistics, when the cutoff point for what is thought of as the perinatal period in those statistics is 6 weeks post-birth. So the key takeaway from that insight really is that the combined impacts of these things are very significant, but that responsibility should not sit with the individual, but the causes are systemic and so are the solutions. And that leads us into insight 2, which is that this is very widespread, it's complex, and it is systemic in our society. So up to half of new parents actually are thought to experience symptoms of depression or anxiety. The data is not very good. We don't collect very robust data on this, but when we combine the estimates of those who are thought to meet the clinical definition of those conditions with those who are thought to experience symptoms that don't quite meet the clinical threshold, but nevertheless are still quite significant and can have an impairing effect in their lives. When we put those two estimates together, almost 50% of new parents are thought to experience some form of perinatal distress. So that's a lot of parents doing it tough. It really can affect anybody, but there are some groups who are at greater risk, and they include Māori, Pacific and Asian women. So you can see perhaps why we have some of the panelists that we have here today. All three of those groups are thought to be at greater risk, as well as disabled parents, LGBTQI plus whānau, very young parents for whom the pregnancy is unexpected, and where there are the presence of other forms of systemic disadvantage, including violence, low income, poor housing, food insecurity. All of these things interact to create very challenging situations for many families. The third insight is that the right support at the right time is really the key to unlocking this problem. So what that support actually is and looks like will be different for every family, because it's very individual to what someone will need at a particular time. But whatever form it takes, having access to it and knowing that you have access to support and knowing that there's someone who could help you if you needed it, is the key protective factor for perinatal and maternal mental health. It works best when it comes from a source that parents already know and trust, which is why it's so important to support community-led, kaupapa Māori, culturally appropriate services. And when it's available, that early support can largely prevent the need to access more specialist treatment, because it can sort of stop the cycle of worsening mental health early on. But if things do get very bad, if someone does become very unwell, at the moment, it's very difficult to access specialist perinatal mental health support. It's inadequate, it's uneven, and according to the DHBs, in their own estimation, may not be equitable in its delivery. So we have quite a big challenge that we need to face. I won't spend much time now talking about the recommendations, but you're welcome to download the report and read them. But essentially, our focus is on the policy solutions. So the types of things that we're talking about in the recommendations is finding ways to alleviate those stresses for parents, make it easier for parents and their whānau to support them. That's things like sufficient income, adequate housing, big structural conditions, removing the things that are making it quite so challenging during this really important time of life. Access to continuous holistic maternity care, supportive birth environments and tailored assistance is really important. As I've said, so is community-led and kaupapa Māori and culturally appropriate services. Making sure everybody knows how to recognise the early signs of distress, making sure that there's access to practical support when it's required, that when services are needed, they are available quickly and they are appropriate, and that when people become very unwell, they need immediate access to specialist support.